So Nic, can you tell us about your research?
My research is on Parkinson's disease. We're looking at trying to find some new treatments and earlier ways of diagnosing this increasingly common disease.
How many Australians are diagnosed with Parkinson's each week?
In Australia, it's 30 people a week diagnosed.
Has that number grown in recent years?
Yeah, it is. It's growing for two reasons. Firstly, increased awareness of Parkinson's disease, but also because the population is getting older.
So what are some of the symptoms of Parkinson's disease?
Well, the classical symptoms of Parkinson's disease are kind of stooping and poor posture, and the kind of shaking and a tremor that you cannot easily switch off. But there's also a host of other less well-known symptoms such as constipation or loss of smell or poor sleep.
Do people take a long time to get diagnosed?
They can do. That's one of the biggest problems with Parkinson's disease research actually, is that the diagnosis can only be made clinically. There's no way to tell unless you present to your doctor with the symptoms, then they give you the levodopa medication which stops the symptoms, and then that's how they know that you actually have Parkinson's disease. So it really is a key need to try to find earlier diagnostic markers.
How do some of the different Parkinson's treatments work?
So at the moment, Parkinson's disease can only be treated symptomatically. So what actually happens is some of your brain cells die, and these brain cells in particular make the chemical dopamine, which controls your movement function. And you can actually take dopamine replacement medicine. So that's what most people with Parkinson's will take. And that works for quite some time to alleviate the symptoms, but it does not cure the disease.
And so what's your research doing?
Our research looks at some of these genetic causes of Parkinson's disease. So they represent maybe about 5 to 10% of all Parkinson's disease cases. But for the first time, we're able to narrow down to certain genes in a person that might actually cause the Parkinson's disease. And by studying these people, we hope to work out the biology involved and try to find earlier than ever before the symptoms of Parkinson's disease.
And if you do get to that stage where you can earlier diagnose Parkinson's, what sort of implications will that have?
Ultimately, we hope to be able to treat it before the brain cells really start to degenerate, and we can really offset Parkinson's disease and send it off into a better answer for that. Sorry.
It's okay.
Can you ask the question again?
Yeah, of course. If you can early diagnose Parkinson's, what are the implications for its prospects to the future?
Yeah, we hope to treat Parkinson's early before a substantial amount of the brain cells are actually dead, and then we can really offset the symptoms of Parkinson's disease and hopefully ultimately even cure it.
How far away do you think we are from possibly finding a cure into Parkinson's?
Well, obviously we're trying all the time, very hard to do. It was first diagnosed recognized as a disease about 200 years ago. So we have come some way in identifying these genetic cases, and I think we're getting closer all the time. Having said that, though, anything that needs to go through clinical trials is quite a laborious process. And again, we have this problem of no early diagnosis, so there's actually not a good group of people to actually test some of these treatments in.
Right, that makes sense. And so, how is Parkinson's research in Australia going?
Researchers in Australia who are doing quite well in the international field. We certainly recognise in Australia that it's teamwork that it's required to do this job, and we're happy to be part of a bigger international team.
Wow.
Parkinson's and neurodegenerative disease in general is becoming an increasingly recognised problem in society. There's been great advances for things such as diabetes and cancer research, but if you become old, meaning you've it's kind of your reward for getting old and surviving a lifetime of diabetes, heart disease and cancer is that you'll ultimately end up with one of these neurodegenerative diseases or dementia, and that's becoming increasingly recognised as a big problem and an area that needs a lot more research into it.
How old is the average person when they get diagnosed with Parkinson's?
On average, I think you're probably into your 60s or 65. but also what's happening these days is a lot of people are being diagnosed a lot earlier. You have people in their 30s that can even be diagnosed with Parkinson's disease. It's no longer a disease of the elderly as it once was thought.
So what sort of symptoms would somebody in their 30s be experiencing that they would go and seek treatment or diagnosis?
Yeah, it's often similar. It starts off with the tremor and not being able to control your movement. Some of these earlier age of onset cases are normally associated with genetic mutations, and they often run in families, and people might be more aware that something might be wrong.